This is a talk that we'll kind of pack in here quickly. I think a lot of the talks to this point have been a lot of logistics. And obviously there's a lot of anxiety around this process, and those logistics are so important. This talk is not so much about logistics. This is me standing up here giving you a little bit of advice on how to both differentiate yourself in a good way and not differentiate yourself in a bad way when you're on your clerkships. So this talk could just as easily and probably more appropriately be called How Not to Screw Up Your EM Sub-Internship. And I don't want to present this from a negative point, but we're going to talk about some common pitfalls that rotating students can find themselves against. So I think the main point that we have to drive home here is you're all sitting here, you're all normal people, and yet you're about to experience something that is incredibly stressful. And sometimes that can bring out the worst in rotating students. And so we recognize that stress. We have to recognize this quote, right? When 4 weeks of your time might dictate the next 3 to 4 years of your life, you want to make sure you cover all your bases. That pressure can be intense. And so recognize that, try to prepare yourself for that. Recognize that it's all going to work out, and no matter how many times we say that today, that you're going to all end up matched at a program that you're happy with, you won't believe us until it happens. So just to drive home this stress, to really like boil it up for us, this was a study that was done in 2000, a survey of program directors asking them what is the most important component of applicants' applications when they're looking for residency match, and the emergency medicine rotation grade was number 1. For those of you interested in a career in academic medicine, this is how you do academic medicine. This is the exact same study published 18 years later with the exact same result. But it means that that rotation is still incredibly important. It also means that you get to pad your CV with the same study every 20 years. Okay, so the sources of advice. I think this is important, right? You don't know me. Dr. Gisandi talked about the importance of an advisor and a trusted advisor. I am not trusted to you, but I will tell you that I culled this advice that I will present, which is relatively simple, from a number of sources. This was my own personal experiences. And then as a chief resident, I actually surveyed all of the chief residents across the country and asked kind of what are the things that make med students stand out in good and bad ways, and that's how this talk was developed. This is a blog post on ALEM. If you want to reference it, you can. You can also go to the bathroom and just read this and skip the next 10 minutes. So as we talk about do's and don'ts, we're going to start with the don'ts. I promise you, you will sit here and you will look at this and you'll say, why is he telling me such dumb things? Of course I would never do that. And yet year after year after year, we see rotators fall into these traps. And so try to listen to me and try to realize that these are pitfalls that can really hurt you. So don't be late. I had a football coach in college who said, if you're not 10 minutes early, you're 10 minutes late. This is like tragic to me, right? You all worked so hard in high school, in undergraduate, in medical school, and then you show up for a shift 5 minutes late, and it's like so impactful, right? This shows a huge lack of respect for your colleagues in a shift-based system, right? Your colleagues who are ready to go home, your patients who are waiting to be seen. Do whatever you can to make sure that you're on time. And if that means showing up to a new city for your away rotation and going to the hospital 3 days before your first shift, figuring out where to park, figuring out where to walk, figuring out all those things, just make sure that you're not late, because it really does reflect poorly on you when you walk into the middle of rounds sweating with your bag hanging off. It's not what we want to see, and it really makes us wonder about the kind of colleague you would be in residency. Okay, don't lie. And you're all going to sit here and say, I'm not a liar. But you're going to want to lie. You're going to want to lie more than you've ever wanted to lie in your entire life, right? You're on a high-stakes rotation, and you see a patient with a sore throat, and I walk up to you, you come to present that patient to me, and I say, what does their throat look like? And you say, oh my God, I can't believe I forgot to look in their throat. And you say, it was a little red. And I know you're lying. I know you're lying because I get lied to all the time. I also know you're lying because I'm going to go follow up and do that exam, and I'm going to know that what you told me was untrue. So you will want to lie. You will forget to do things. You are not perfect. You are medical students. The best thing to do is say, I didn't do that. I'll go do it right now. And when we see students who do that, who are willing to admit their faults, that also shows us a huge bit about their character, right? You're humble. You have a growth mindset. You're willing to acknowledge areas where you can show improvement. And then it also identifies an opportunity for teaching, right? We can talk about how when a patient comes in with a sore throat, we should look in their throat, and we all get to learn, right? So don't lie. Don't be a jerk. This is a quote. I have 2 young sons. I read this to them a lot. They roll their eyes at me. You will roll your eyes at this. But this is, again, kind of simple kindergarten stuff, and yet year after year after year, we see students who kind of present themselves in different manners to different people, right? So you are hardworking and diligent and kind and polite and professional to the clerkship director, to the associate program director, but you treat the clerkship coordinator like garbage. It turns out we all work together. The most dramatic story I will give here is a student who, this was for interviews, who flew into a city for interview, took an Uber from the airport to their hotel, and treated the Uber driver incredibly unkindly. That Uber driver was the partner of the clerkship or of the residency coordinator, and that applicant, that was discussed, their behavior to their Uber driver was discussed as this candidate was being considered for a residency, right? So recognize that if you're in a city on an away rotation, put your best foot forward. Fake it for a month at least. Okay, don't break the rules. And I think this is one that's a little more nuanced and it's specific to each individual institution and maybe each individual shift. But typically you're going to come onto a shift and you're going to work with a senior resident or an attending, and they're going to say, these are the guidelines by which I like to work with students. And they're going to give you 3 or 4 points. Listen to those points, remember those points, and fall in line with that, right? These guidelines are in place to make sure that patient care is safe, that you all are safe, and time again, students will get commented on in their inability to kind of conform to the guidelines that are being presented, right? I want you to see patients. You can pick up whatever patients you want. If they have abnormal vital signs, please let me know as you pick them up. It doesn't mean you don't get to see them. I just want to know about their abnormal vital signs earlier in the course than later in the course, right? But if you pick up a patient whose heart rate is 160 and I don't hear about it until you're presenting it, you've failed to meet my rules and my expectations, and that makes it hard for me to trust you and to feel like you're going to be someone who's going to be teachable when you come to residency, right? Don't forget why you were there. So as medical students, you all have a privilege of time, right? You typically don't have this immense pressure to move the meat through the department. And so spend that time focusing on patient care, right? The reason you are in emergency medicine is to take great care of patients. Oftentimes on sub-internships, there is this desire or this false notion that if you sit down next to me and you talk to me about my hobbies and we connect about mountain biking or hiking or surfing or whatever, that I'm going to like you and you're going to come to residency. I may like you. That is not why I'm selecting people to come to residency, right? I'm selecting people who care about their patients, who want to work hard and want to provide excellent patient care. So if you and I have no conversation, I don't know anything about your hobbies, you know nothing about my hobbies, but I see you every day sitting at your bedside, taking great care of your patients, that's the resident I want, right? I got plenty of friends to go mountain biking and surfing with. I'm looking for people who want to take care of patients. I actually don't have that many friends. Okay, so that was a quick don'ts. We're going to do quick do's, and then we'll have at least a couple minutes for a break. Do be enthusiastic. I think emergency medicine is hard. Emergency medicine has been hard for the last couple years in particular. You all are fresh and excited about emergency medicine. Use that as a strength. Show up to shift, be enthusiastic, be engaged, ask questions. I think this is a transition from don'ts to do's, so do be enthusiastic, but at the same time, we know that there's some kind of dark humor in emergency medicine, right? The gallows humor. And as medical students, it really doesn't benefit you to participate in that, right? You shouldn't be jaded yet. I hope you never are. But again, oftentimes students feel compelled to mirror that behavior in an effort to fit in. Don't let that happen. It doesn't serve you. It doesn't serve your patients. Remain enthusiastic. Okay, this is probably the most valuable logistical point of view from this entire talk. I do think these points of advice are important, but this is probably the one that you can work on the most prior to your presentations. You are third-year medical students, rising fourth-year medical students. We don't expect you to be able to float a transvenous pacer on your own. We do expect you to be able to give a presentation, right? And so this is where you should spend your time practicing. It may sound silly, but get together with some friends and drill your presentation, right? Have that concise emergency medicine presentation, stick to the script, present your pertinent positives, pertinent negatives, and build your differential. This is what differentiates you, right? Every patient you will see, you will present to an attending, you will present to a senior resident, and if you do that in an organized, thoughtful manner, that absolutely helps differentiate you. There are a number of tools that can be useful as you prepare. So this rapid reference, and then the 3-minute emergency medical student presentation is a paper that kind of walks through those, again, tips and tricks. I want to reiterate those pertinent negatives are really important, right? That helps me understand as you're presenting the differential you're building, right? If you have a chest pain patient and you say they're not on exogenous hormones, they have no recent long-term immobilization, they have no history of VTE, I know that PE isn't in your differential, and we can already start to develop a shared model around that as you're presenting, right? So really make sure you're being thoughtful about those pertinent negatives. This is a challenge I offer to all of our rotating students. You're all smart. You don't need notes. It is a crutch. It gets in the way of your opportunity to interact with your patient. I promise you, if you get rid of the notes, you will have more fulfilling patient interactions, and you will see no loss of fidelity in your ability to withhold that information. You can have a piece of paper in your pocket. You can jot down vital signs. You can jot down allergies, drugs, but try to be present in the room. And in reality, none of you will go on to practice emergency medicine, either in residency or beyond, sitting at the bedside with a notepad, writing down 44-year-old male, chest pain, 2 days, right? So this is going away. It might as well go away now. Take initiative. I think this is simple, and again, this is dependent on your institution. The example I give for this is at Denver Health, where I work, we have 3 ultrasound machines across the department. We have a trauma area where we have 7 front room resuscitation bays. And the goal is that there's always kind of chaos trying to get the ultrasound machine to a critical patient. As a medical student, you can take initiative. You can hear an overhead page for a critical trauma patient. You can grab that ultrasound. You can bring it into the room. I get that some people may perceive that as a service element, and that's not necessarily what we want. But it also shows that you understand the needs of the department. It also puts you in the room with an ultrasound machine at the bedside of a critically ill patient. And so it serves your education as well. So be proactive. If you're going to do a procedure, try to find the materials you need for that procedure before you ask. I always tell our students to spend some time the first day that they're at our rotation in the supply closet, right? Get your hands on things, figure out where things are so that you have some ability to be self-sufficient over the course of your rotation. Commit. Again, this is a huge differentiator, right? If many of you may be familiar with kind of the RAMS framework for medical education, right? Moving from a reporter to an interpreter to a manager. This is what we want to see on your presentations, right? We want an organized presentation, and we want you to come up with a plan. It may be a terrible plan. That is fine. Again, we don't expect you to know everything, but we have to start with a plan. So make sure that every presentation ends with a plan, and ask yourself, if I were the only medical provider caring for this patient today, this is what I would do. And your plan may be I would MRI their entire body and admit them to the ICU, and that's fine. It's a place where we can discuss what your differential is, what your concerns are, and we can work from there. But if you just present that information and kind of look at me and say, well, we could discharge them, or we can admit them, right? That doesn't tell me that you're engaged in this process and committing, right? You're not trying to guess the right answer. You're trying to say, this is what I would do, and then get feedback to grow on that plan. Have a goal. I think this is a huge differentiator, again, in terms of those applicants or residents who have a growth mindset, which is what we're all looking for. Residency is hard. We want you to show up, be motivated, have some self-reflection to know where your weaknesses are, and then we can build a plan to develop solutions to address those weaknesses. So that's true on your clerkship as well. You can show up, you can say, today I really want to work on seeing patients without notes and organizing my presentations in my head. That's a great place to start, and we can offer feedback and coach around that. Lastly, use your resources. There are tons of them. I think EMRA is an amazing resource for kind of pocket guides or phone apps that give you succinct, concise, helpful tools to make sure that the clinical knowledge that you need on shift is available and ready and at hand. So familiarize yourself with these resources prior to your rotation, and that will really make it easy when you're actually in the department. So I know that was quick. I know that this is like what I learned in kindergarten, but every year we see people fall into these traps. So remember these things. Don't be late. Don't lie. Don't be a jerk. Don't break the rules. Don't forget why you were there. Probably most importantly is to take great care of your patients. Be enthusiastic. Perfect your presentation. Spend time practicing. Take initiative. Commit. Have a goal, and use your resources. Cool. If there are any questions, I'll hang here, but we probably want to give ourselves maybe 5 minutes for a break, and then we'll only be 5 minutes behind, which is quite a bit better than I thought we would be. Thank you.